So today we're going to talk about the QL muscles. So they live in between your ribs and your pelvis, and then all of the lumbar vertebra. So just in through here. So a lot of people come in here and they get back pain, say in this lower region, can be the sacroiliac joint or L5S1, that kind of area in the lower back. Now, what I've found over the years is that people who are right-handed tend to have right-sided pain. And then when I'm palpating or feeling around in their spine, I'll actually feel they've got more muscle on the left side. When you think about it, well, they're dominant on the right, you'd expect them to have more muscle on the right side. So having you think about that even more, think about what the QLs do, it starts to make more sense. So the QLs, if you're taking a step when you're walking, they're going to stop your pelvis from flicking out to the side, as do glute medius and the lateral, the hips, that will stop them as well. But if you put your foot down, say your right foot, the left QL is going to grab to stop your pelvis from flicking out like that. The right side will also kick in, but the left side will do it more. And you experiment by putting your thumbs into your QLs, just in between the ribs and the pelvis, and then taking a few steps and just seeing what you feel. And you usually feel the opposite QL go with the leg. Now, if you think about all your life, if you're right-handed, you've been carrying things in your right hand. So when you're holding something, then this muscle on the left is actually going to be stopping the torso now, the ribs, from going over to that side. So if you want to feel it even more, get a heavy weight, usually a kettlebell or something heavy. This is very light. You want something like 20 kilos or so. Put it in that hand, put your thumb in there, and then walk, and you'll actually feel that muscle really kicking in. Now, what you can do to counter that is a great exercise to throw into your gym regime if you, especially if you have lower back pain or SIJ pain, that kind of thing. Start doing some suitcase carries, which is exactly what I just did then. Get a heavier weight, about 20 kilos or so, put that in your left hand, and you're just going to be walking nice and slow and controlled. Do about 10 meters backwards and forwards, and at that end you can do 3 sets of 10 or so, but that gives you a bit of an idea of then how, if you're right-handed, your whole life you've been firing up those muscles, using those left-sided muscles. So then the theory is that on the right side that actually becomes weak, and because it's trying to work a lot harder, becomes much less stable on that side, because it's got less strength. The right side of your lower back can actually become painful and irritated. So throw that in. Other things you can do is when you're, say, going to get some groceries, instead of picking up your groceries with the right hand, pick them up with the left hand. Anything you can do to start using that left hand more, and start taking strengthening up that right side, taking some of the pressure off that right joint. Give it a try and let us know how you go.